Over 3 million ICLs from STAAR Surgical have been distributed worldwide over the past 30 years, a testament to their efficacy and safety. Yet surgeons often struggle with patients' misconceptions and unrealistic expectations. Today, Dr. Ernesto Alonso shares his proven communication strategies to enhance outcomes and satisfaction for patients, surgeons, and clinics.
It's very important that you are convinced as a doctor of what you want to offer to the patient. I usually ask the patient what do they know about refractive surgery. I mean, I like to know what information they already had before they went to the clinic and after counseling by the clinic. And then I like to show them a short video animation of the different procedures, especially corneal surgery and lens-based surgery. And after that, when they see the different procedures, I like to inform them of the different advantages or disadvantages of each procedure. We like to do the whole examination process with all the complete examination of the eye. The optometrist is going to make the examination and then it's going to send us the complete study. And after that, when all the data, when we get all the data, is when we decide what we have to speak to the patient about. It's important to know that all these procedures are accepted and they have really good results. From my point of view, when I speak to a patient, first I say the advantages of the laser surgery. The first advantage is the price, which is pretty cheaper than the other one. The fact that you are not going into the eye. It's an extraocular procedure. Those are the disadvantages of the ICL, the lens-based surgery. And then I focus on the advantages of the ICL, of phakic lenses. And these are four, basically, which is the fact that it's removable, the fact that if you have any problem, you can remove the lens and maybe the eye is going to be the same as before. This can happen with corneal surgery because once you do the procedure, it is done. The fact that you get a better visual acuity, this has been proved in tests. I mean, we're talking about very good result in both, but ICL has slightly better results in vision acuity, especially in contrast sensitivity. When you have a laser surgery procedure, you have a risk of worsening the dry eye or creating a dry eye, and this can happen with the ICL only the few first days because of the incision, but you're not going to have a dry eye because of an ICL. And finally, the fourth advantage of the ICL, which I think is very important, is that you're going to preserve the cornea for the future. In this patient that is 30 years old, 25 years old, and is taking the glasses away with an ICL, with a phakic lens, probably will have other surgeries in the eye, such as presbyopic surgery or cataract surgery. And in these cases, at least in the actual moment, the precision of on the calculation, the biometric calculation of intraocular lens is going to be better in an eye that is virgin, is not being treated in a cornea, than when you have a treated cornea. And on the other hand, the aberrations, the optical aberrations, will always be better if your cornea is intact. These are the four advantages for the ICL towards laser.